the field of imaging biomarkers in Parkinson's disease has been quickly evolving, and there are some really key data that's come out of some of the larger studies. One of the ones that I'm the most familiar with and involved with is the Parkinson's Progression Marker Initiative, and looking at how we can best use different cutoffs with dopamine imaging for identifying the earliest patients who might have a Parkinsonian syndrome. And that's sort of looking at that data, particularly in identifying patients who have what we refer to as a striatonigral degeneration. So those who most likely have a dopamine degeneration. What's really exciting is that there are some MRI techniques that are up and coming that have shown a lot of promise that can potentially also show a similar type of thing. And that's really exciting because MRI imaging is used in almost all clinical trials as a screening tool. But now we need to get a second separate scan with the DAT scan to look for a dopamine deficiency. If any of these MRI techniques end up being well validated in showing similarly to be able to identify a striatonigral degeneration, then potentially that could reduce costs and also reduce patient commitment for the number of scans they need for clinical trials. One of the biggest advantages of an MRI-based imaging biomarker rather than having a separate nuclear medicine-based scan, either a SPECT or PET scan, is that MRI is available much more broadly than the PET or SPECT scans. And so availability to patients is the first advantage. The second advantage is cost. Again, MRI scans are obtained typically to look at other things as well. And so the SPECT or the PET scan is often a second additional scan. And so the ability to have most of your questions answered with just one scan obviously reduces costs. And in clinical trials, that's where this, I think, has the biggest impact, is that having to just get one scan instead of two scans. And the third big advantage is patients' time. Obviously, being involved in any type of research, whether it's observational research or clinical trials, involves a lot of in-person assessments. And anything we can do to reduce the number of times a research participant or a patient has to come in to get an analysis done is an improvement, because it's less time on the patient's part.